Guys, enuresis, according to you, what is enuresis? Anyone?
बेड वेटिंग मतलब आप जब सो जाते हो, मतलब आप कॉन्शियस नहीं होते हो और आपको यूरिन पास हो जाता है ड्यू टू स्फिंक्टर एनोमली और मे बी समथिंग.
Yes, very true. So, urine incontinence, that is called as enuresis, is a loss of bladder control. तो कैसे पेशेंट को हमें ट्रीट करना है? एन्यूरेसिस के अंदर, if parents came to you with the age at the age of 3 years child, are you going to treat that child? So what is the age criteria to treat enuresis? Any guess? कौन सी एज के बाद you can treat enuresis patient? Yes, Sakina, 5 years, okay. यूरिन कंट्रोल कब शुरू होता है? Anyone knows?
At 2.5 years of age.
Yes, that is at the age of 3 years. Okay. So when parents came to you at the age of 3.5, in that case, are you going to treat that child or not? Anyone? Are you going to treat or not? It's a simple question, huh? Yeah, na?
If it is, if there is no control over the urine, you can, but I think stool control is roughly obtained at around 3 to 3.5 years of age.
Okay.
So that need not be treated.
Okay. तो कब treat करना चाहिए? At the age before 5 years of age, generally in our practice, what we are doing, कि जब भी 3 या 5 से बीच में जब भी पेरेंट्स लेके आते हैं बच्चों को, तो वी जस्ट लेट देम नो कि 3 ईयर के आसपास एट द एज ऑफ 3 इयर्स बच्चों में यूरिन कंट्रोल आता है, लेकिन इन सम चिल्ड्रन, इन सम किड्स, इट टेक्स टाइम टू कंट्रोल अप टू द एज ऑफ 5 और इवन 7. तो एट द एज ऑफ 5 तक वी आर नॉट ट्रीटिंग सच बच्चास. वो बच्चे हम ट्रीट नहीं करते हैं, and we just let them know if it is persisting, continuously occurring since age of 5, then we will go for treatment. तो 5 साल तक we are not going to treat such बच्चास in our practice. जैसे ही बच्चा बड़ा होता है, he become more able to control their bladder. The waiting is called as enuresis when it happens in children who is old enough to control their bladder. मतलब 3 साल के बाद, even at the age of 5 years, when बच्चा is not able to control the bladder power, then it is considered as enuresis. It can be happen at the daytime, it can be happen at the night time. अभी रात को जो यूरिन हो जाता है उसको क्या बोलते हैं और मॉर्निंग में जो यूरिन हो जाता है उसको क्या बोलते हैं? Do you know the terminology? We called it as a nocturnal enuresis. That means जब भी रात को यूरिन हो जाता है, that is called as nocturnal enuresis. Now what about day? दिन के टाइम में जो यूरिन हो जाता है, that is called as, yes Sakina, that is
Diurnal.
yes, that is diurnal enuresis, which is not frequently used term, but as we are discussing enuresis, we must know that is called as diurnal. दिन में यूरिन हो जाता है. This condition is very frustrating condition for parents, even for kids. It is important to be patient and remember that it is not your child fault. So जब भी आपके पास ऐसे पेशेंट आते हैं, एक्सप्लेन देम कि भाई ये बच्चे की तकलीफ नहीं है, बच्चे की वजह से नहीं है, तो नेवर स्कॉल्ड योर चाइल्ड, स्पेशली फॉर एन्यूरेसिस। एन्यूरेसिस के लिए बच्चे पे चिल्लाना या फिर बच्चे को धमकाना इज नॉट अ सॉल्यूशन, बल्कि दैट कैन बी वर्क्स एज अ फियर, तो उसकी वजह से ये तकलीफ बढ़ भी सकती है। सो एक्सप्लेन द पेरेंट्स कि जब भी बच्चा एन्यूरेसिस हो जाता है दैट इज नॉट अंडर द कंट्रोल ऑफ किड, तो एक्सप्लेन बच्चे को in some cases you have to appreciate when he is not passing the urine. For example, बच्चा हफ्ते में 4 बार यूरिन कर रहा है और in this week he just pass it for 3 days. Appreciate the child कि इस वीक में आपने 3 बार ही किया है compared to previous week. So that appreciation helps the child in cases of enuresis. There are 2 types of enuresis. Anyone know the types of enuresis?
Primary and secondary.
Yes, primary enuresis and secondary enuresis. What does it mean? Primary enuresis and secondary enuresis?
Primary enuresis is usually without any cause, that is, it is idiopathic. And secondary enuresis is because of some pathological condition that the bladder has lost control, any neurological deficit or something like that.
No, not like that. Primary enuresis is that बच्चे ने लाइफ में कभी भी कंट्रोल ना किया, and since birth he is suffering from enuresis. For example, 3 साल तक बच्चे को यूरिन हो रहा है, 1 साल तक बच्चा ने यूरिन कंट्रोल किया, and then after again he is passing the urine, that is called as secondary enuresis. Lekin when patient came to you since at the age of 5 years or 7 years और बच्चे को यूरिन कंट्रोल हुआ ही नहीं है, बच्चा ने यूरिन ट्रेनिंग फेज आया ही नहीं है, if that condition is that is called as primary enuresis. Are you getting my point? Not fully trained for toilet training and still suffering from enuresis, that is called as primary enuresis. And secondary enuresis, बच्चे ने वो कंट्रोल कर लिया है and then again start that enuresis, that is called as secondary enuresis. Are you getting my point, guys?
Yes, sir.
Yes. Now, what are the causes behind bedwetting? Guys, this is now your turn. What are the causes behind bedwetting? Anyone? Any causes according to you? Enuresis क्यों होता है? Primary or secondary, whatever it may be the cause. What are the common causes? Yes, Sakina, worm infection. It is the rarest cause which is not mentioned in your any Google way. Lekin the one of the main cause is worm infection. Yes. Any other cause? Yes, fear. Fear and all psychological causes are more prominent in secondary nocturnal enuresis. That is always there in primary enuresis, but in secondary enuresis, psychological causes more prominent. Yes, pincher control is one of the cause. Central nervous system, CNS, is defective. Yes, Himanshi, UTI is one of the cause, one of the most common cause, especially in female kid. Any other causes you know? For nocturnal enuresis or diurnal enuresis.
Constipation.
Constipation, ये कौन बोला?
Dr. Honey, sir.
Okay, it is one of the cause. When child having constipation, when he strains to pass the stool, that strain causes pressure on bladder, and due to that, bladder loses the control. So constipation is one of the cause. It is the rare one, but yes, it is one of the cause. Any other causes you know? UTI, worm infection, sphincter control, fear, psychological cause. Yes, Shruti, diabetes. कई बार from the nocturnal enuresis, from the diurnal enuresis, we just diagnose diabetes in pediatric patient. When child is not able to control the urine and frequency of urine increases at night, always think of diabetes in pediatric as well as adult patient. In pediatric, when there is not gaining weight, diabetes might be the cause, along with nocturnal enuresis. Yes, delayed milestone, Himanshi, you are absolutely right. Delayed milestone is one of the cause. Although it is not a completely understood why bad wetting occurs. It is thought to happen because of delayed development in at least one of the following three causes. One is bladder. I'm talking about local cause, that is bladder. Another thing, that is kidney, and the central nervous cause is brain. So in sometimes deformity is there, bladder is very short or bladder is hyperactive. In those cases, that nocturnal enuresis can be happen. Sometimes due to kidney, urine is made excessively at night. That is the normal phenomena of the kidney in some patients. That might be the cause. And in some children, in some babies, a brain is the cause in which they are not able to wake up during the sleep. मेरा बच्चा बहुत लेजी है, पूरा दिन खेलता है, लेकिन रात को इतना सोता है, इतना डीप स्लीप में होता है, he is not able to wake up. These are the cause. So how to explain those patients? That is more important. In babies and toddlers, links between the brain and bladder is not fully developed. Parents को समझाओ कि रात को जब बच्चा सो जाता है और सोते वक्त जो bladder के ऊपर का कंट्रोल होता है from the brain, which is not yet fully developed, and that might be the cause कि जिसकी वजह से child is suffering from enuresis. The kidney, the bladder, you are not going to report, you are not going to search for the cause, but you have to explain the parents. This might be the explanation कि आपके बच्चे का जो एज के साथ यूरिन के ऊपर का कंट्रोल होता है, which is developed in brain during the sleep, which is not fully developed. That might be the cause कि जिसकी वजह से बच्चे को nocturnal enuresis हो रहा है. This allows child to control when the bladder empties. This control usually develops during the daytime first. That is normal phenomenon. More time before it happens at night. Compared to night, ये generally day में develop होता है और रात को बाद में develop होता है. So in causes, genetic cause is one of the cause. If child is suffering from bad wetting after the age of 5 years, child may have suffering from some genetic cause. Genetic cause के अंदर we must ask the parents about the same complaint in their child. If parents are suffering from the bedwetting in their childhood, that might be the cause of children. Parents में child भी हो सकते, मतलब पापा भी हो सकते हैं, mother भी हो सकते हैं. Anyone from both of them were suffering from the nocturnal enuresis in their childhood, that might be the cause कि जिसकी वजह से बच्चा is also suffering from nocturnal enuresis. %70 बच्चों के अंदर generally this might be the cause. बच्चों के अंदर ये cause होता है. So try to find out this cause when patient came to you. One more common cause, that is deep sleep. Deep sleep pattern can be the part of normal adolescence development. When bacha is going to enter into adolescence phase or in teenage, in those cases, deep sleep is very common. Another thing, that is poor sleep schedule or too few hours sleep. Bacha is very much active, constant. He is going to school, and then after on activity, then after tuition. Bacha is very much active in the daytime. And due to that, bacha is not able to wake up at night when he gets urge. This is the common during the puberty age, especially in the teenage at the school time. Now our favorite as a homeopath, the psychological cause. When bacha came to you with nocturnal enuresis, always try to find out the psychological cause. Stress is one of the main triggering factor in nocturnal enuresis.